Warning from the World Health Organization for people who have recovered from the coronavirus. Good evening. I'm Juliette Goodrich.
And I'm Brian Hackney. KPIX5's Betty Yu has more on why top doctors say if you've already had the virus, there is a chance you could get it again. Betty?
Brian, there's been a lot of talk that the presence of antibodies in people who have had COVID-19 would make them safe to resume normal life. The World Health Organization has now weighed in, saying it's unknown if antibodies are protective, what degree of protection they provide, and for how long. In a newly published scientific brief, the World Health Organization said that there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from getting a second infection. Previously, some governments have suggested that the presence of antibodies could serve as an immunity passport or risk-free certificate that would allow people to return to work or travel.
WHO is reminding us, and if we need reminding, that it's premature to state that the presence of antibodies against COVID-19 offer protection. That may be true. It may not be true.
Professor of Epidemiology Art Reingold at UC Berkeley says protection from the coronavirus could last a few weeks, months, or years, but it's unclear at this time.
There are a lot of infectious diseases where antibodies don't protect you against reinfection. A good example is HIV. Another good example is hepatitis C.
The brief said people who assume that they are immune to a second infection because they have received a positive test result may ignore public health advice. The use of such certificates may therefore increase the risks of continued transmission.
I think the other thing to remember is that only a small number of people in the Bay Area are going to have or will have been infected and have antibodies anyway. They're probably on the order of 1 or 2%. Maybe. So it's not going to be like half of the population has these.
Dr. Rutherford added that when the time comes, he's advising people to get their flu shots because we will have COVID-19 and influenza circulating at the same time this fall. Brian?
Betty,